A 6-year-old baby present with groin pain. He is known to have disrupted class. He reports that he is bullied for being short. On examination, he has antalgic gait and pain on internal rotation on the right hip. What is the most likely diagnosis? Here the options are Perthes disease, transient synovitis, slipped upper femoral epiphysis or SUFI, development dysplasia of the hip, septic arthritis. So what may be the diagnosis? And here the key point is there is the groin pain, antalgic gait, and there is pain on the internal rotation. Now see the Perthes disease. The Perthes disease is usually present with the hip pain, and this pain may goes to the knee. So hip pain, it may be goes to the knee and occurring between 5 to 12 years of the age. This point is very important. This time period is very important, that from 5 to 12 it is the Perthes disease, and below 5 years and more than 5 years. This also the another two disease present. That means the Perthes disease 5 to 12 years of the age, and below 5 years there is another disease, and after 12 years there is the another disease, and before 5 years this is the DDAs, that means the development dysplasia of the hip, and after 12 years the disease which is known as the SUFI, that means slipped upper femoral epiphysis. So this line is very important to answer this type of question, and usually it is age dependent. That means when the age between the 5 years, usually the diagnosis is DDAs. When it is 5 to 12, it is Perthes disease, and when more than 12 disease, it is usually SUFI. And the mnemonics is the DPS. So D for DDAs, P for Perthes, and S for SUFI. And bilateral disease in 20% of the cases, X-ray will show flattened femoral head, and this is the Perthes disease. Remove pressure from the joint to allow normal development. Physiotherapy may be needed, and usually self-limiting. That means this disease will recover spontaneously. So look for the age, it is 6. That means from 5 to 12. From 5 to 12 it is the Perthes disease. So only age also enough for diagnosis this 3 disease, which is the DDAs, that means development dysplasia of the hip, Perthes disease, and SUFI. And other option here, such as the slipped upper femoral epiphysis, here the radiology is different. Development dysplasia of the hip, it is also different. And in case of the septic arthritis, there is all feature of inflammation present, such as the fever, redness, tuberculosis. This type of all feature present in case of the septic arthritis. So our diagnosis is the Perthes disease.